Hey guys, this is Dr. Hub. Now we'll look at the ASHA. So ASHA stands for the Accredited Social Health Activities. So it is Accredited Social Health Activist. So the general norms with respect to the ASHA workers, it must be a woman in age group. So it includes a woman. And this woman is in the age group of 25 to 45 years. So they may be married, divorced or widow. So they must be a resident of the village. So they are a resident of the village. And there is a formal education. There is formal education and up to 10th standard. And if no candidates are available, the requirement can be relaxed to 8th standard. So they can also be the 8th standard. And at least one ASHA. So there is at least one ASHA, and this is for a population of 1000. So in terms of tribal, the hilly or the desert areas, the norm can be relaxed to one ASHA. So there can be one ASHA per habitation. Then the states can relax the norms on population and education qualification. The states, they can reduce further. They can reduce the norms on the population and the education qualification on case-to-case basis, depending on the local conditions. However, there are exceptions and not the general norm. So they are the exceptions. Then let's look at the responsibilities of the ASHA. So responsibility of ASHA, it includes, there is health education, health edu, and also the awareness. Next is there is the reproductive health as well as the child health and family planning. Next, it includes the facilitate the access of health services. So it facilitates the access as of the health services. Then there is promotion of sanitation. There is promotion of the sanitation and also the household toilet construction. Household toilet construction. Next, there is provision of primary medical care. There is provision of the sanitation and the household toilet construction, this we saw. Then there is a provision of the primary medical care. Provision of the primary medical care. And this is for the minor ailments. This is for the minor ailments. Next, we also have the provider of DOTS. There is provider of the DOTS. Next, we look at the depot holder. So they also act as a depot holder, and they are depot holder for essentials like the ORS. Then they also have the iron and FA, iron folic acid. Then there are also have tablets. They have condoms, disposable. They have disposable delivery kits. Next, there is also the dispersible. There is dispersible of the health information. And this is on a community to higher centers. Next, in terms of some responsibilities are integrated with the Anganwadi workers. So some responsibilities are integrated. This is the Anganwadi workers and the auxiliary nurse midwife. The auxiliary nurse midwife. Now let's look at the home visits. The home visits, and this is going to be of the ASHA by the ASHA under the home-based newborn care. Home-based newborn care. So in short, it is known as a HBNC. So here it is 7. Here it is 7 visits. So 7 visits after the home delivery. 7 visits after the home delivery. And what are the days of it? The days it includes is 1, 3, 7, 14, 21, 28 as well as 42. So 7 visits after the home delivery. Next, there are 6 visits. 6 visits after the institutional delivery. After the institutional delivery. And these are occurring on days 3, 7, 14, 21, 28 as well as 42. So this is in case of the vaginal delivery. Vaginal delivery. There are 5 visits in cases of cesarean. There are 5 visits in case of the cesarean section delivery. So where the mother returns home after 5-6 days. So the mother, they return home after 5-6 days. And that is on days 7, 11, 7, 14, 21, 28 and the 42. Next, we will look at the home visits by the ASHA worker. So, home visits, this is by the ASHA. Home visits of the ASHA. This is under the home-based care of young child. Home-based care of young child. HBYC. So, here there are total 5 visits. They are scheduled after 42 days. And it is under the home-based care of young child. That is, let's write it down, home-based care of the young child. So the ASHA, what they do is, the ASHA, they will provide quarterly home visits. Yeah, quarterly home visits, and they are done in cases of 6, 9, 12 as well as 15 months. 3, 6, 9, 12, 15 months.